Hi, everyone. Welcome to Diabetes Primetime. We are speaking with diabetes expert Dr. Railey, answering your questions about diabetes, medications, and more. Before we get started, tell me in the comments where you're watching from and let us know if it's your first time joining us. Diabetes Primetime is brought to you by Relion Community, an amazing program available exclusively for Walmart customers with a Relion Premier meter. Get free diabetes tips, recipes, and support sent right to your phone. Just click the link in the comments to learn more. Dr. Bailey, thank you so much for being here with us.
Happy to be here. Appreciate the opportunity.
So, I'd like to start out with questions we've gotten on our Facebook page. Someone asked, I know diabetes raises blood sugar. How does it affect the rest of my body? What else should I be looking for?
Diabetes has multiple impacts on the body. Regarding specifics to how it impacts the body, almost every organ is impacted by diabetes. Elevated blood sugars has impacts on the brain. Elevated blood sugars has impacts on the heart, impacts on our nerves, on our blood vessels. Some of the complications or the apathies of diabetes include neuropathy, which indicates issues with the nerves, retinopathy, which can cause issues with blindness and decreased vision, nephropathy, which impacts the kidneys. We also know that diabetes increases the risk of heart disease. And so it's extremely important to think about these long-term consequences and the organs that are impacted by uncontrolled blood sugars.
So, you're just laying out one of the many reasons that we encourage people not to look at just their A1C, but also their blood pressure, their cholesterol, their EGFR for kidney health. Are there any other numbers that you would suggest people track to kind of track their overall health with diabetes?
One of the most important numbers to track or data to follow really is the daily blood sugars. Many patients with diabetes need to understand the impacts of what they eat and their activity on their actual blood glucose level. So, at the simplest, understanding goal blood sugars both in the morning and also after eating is extremely important. Outside of those numbers, understanding your hemoglobin A1C, what you and your provider's goal for you as an individual patient should be. In general, that number is around 7. Some providers working with their patients will often modify those goals. And so that's an individualized approach that you should have with your provider. But in general, 7 to 7.5 is a good number for a hemoglobin A1C.
Another great question from someone on our Facebook page. They asked, does eating food in a certain order affect blood sugar?
In fact, the sequence in which we eat our food does have impacts on our blood sugar. There's a so-called food sequencing effect that can occur. So as we are advising patients to think about how they eat and be very intentional, the order in which you eat your food may make a difference on your blood sugars. In general, considering eating proteins and fats first might impact the absorption of your blood sugar and slow it down. We also recommend patients think about fiber intake. Fiber overall slows your digestion. So if you had a choice on eating your meal in a particular order, starting with proteins and fats, potentially consider fibers next, with carbohydrates later in the meal. The whole point is to slow glucose absorption. Give yourself time to actually recognize that you're full. So another component is taking your time to eat. Individuals, perhaps nowadays with our larger portions, it may be best to consider slowing down how fast you eat, which will allow you to be very intentional about what you're eating and thinking about the order, as well as prevent overeating, which sometimes can lead to elevations in your blood sugar. The other recommendation that I think is very practical for people to consider is what you drink as you are eating. And so sipping water or having sips of water can also assist with slowing down digestion, which overall will lead us to eat slower and be more intentional and thoughtful about the food that we're putting in.
Oh, this is such great information. And as you're speaking, I'm thinking about like when you go to a restaurant, you almost always get the carbs first. You know, the bread basket comes or the chips and salsa. And how many times have I filled up on that and not realized how much I was eating? So, really, you're saying the opposite. Like, don't get the bread basket until the end of the meal after you've eaten your protein and your fiber and your healthy fat.
Another practical tip as we think about eating and being intentional, particularly if you're eating out, which I would suggest you do need to limit. One strategy that might be practical for you to employ is actually asking for your to-go box at the beginning of the meal. Sometimes this can be helpful, particularly as we get larger and larger portions, that if you ask your server to give you a to-go box, you can take some of that meal that likely is already more than one serving and separate that with the plan not only to potentially consume that later, but think about the practicality of maybe saving some money from having two meals out of one. So in addition to being intentional about the sequencing and perhaps eating your carbohydrates later, it may be we just need to take more food off of our plates.
We're going to pause here and do our trivia question. Folks, if you answer this question in the comments, you'll get our helpful guide to hypoglycemia that explains what to do in case of a low blood sugar. And you'll get that guide for free if you answer our trivia question, which is, which vitamin is known as the sunshine vitamin? Is it vitamin D or vitamin E? That question again, which vitamin is the sunshine vitamin? Is it vitamin D or vitamin E? Put your best guess in the comments and you'll get that guide delivered to your Facebook Messenger inbox. And folks, if you can think of any friends or family members who might find this show helpful, be sure to tag them in the comments so they can tune in too. Okay, Dr. Railey, the next question we got was this one. How does having cancer impact diabetes management? What would you want someone who may have a new diagnosis of cancer to know about how that's going to impact their blood sugar?
One of the key ways that cancer can potentially impact diabetes is that these diagnoses often change metabolism. And so, given our metabolism is involved in how we process foods and process sugars, depending upon the type of cancer, it may impact nutrition, it may impact uh, satiety, it may impact desire to eat. It also potentially has impacts on weight loss and weight gain. And so, depending upon the diagnosis, first off, just being very thoughtful about how that could impact eating habits, also weight gain and weight loss. Another way that cancer impacts diabetes may have something to do with the treatments. Oftentimes, if a patient is receiving chemotherapy or other types of therapy, there are also medications that clinicians will prescribe that could impact blood sugar. For instance, steroids, which can be used to mitigate some of the symptoms from various chemotherapies, may have the inadvertent side effect of raising blood sugar. I want to also just mention that the diagnosis of cancer itself can be difficult for patients and families. And we know that the stress component of care is important to consider. Stress can raise cortisol levels in the body, which can then raise blood sugar. So as patients are dealing with difficult diagnoses and changes perhaps in expectations and habits, we also need to think about the stress component of managing a diagnosis like cancer and getting the support necessary overall to reduce stress if possible and get support. So thereby blood sugars aren't also going up simply because of the worry or anxieties around the uncertainties of having such an impactful diagnosis.
Someone else wanted to know, are there special dangers of COVID infection for people with diabetes? Should people with diabetes be more concerned about a COVID infection?
There is consistent evidence that unfortunately individuals living with diabetes that also contract or at risk for contracting COVID have increased mortality or death rates and potentially morbidity or complications. So having a diagnosis of diabetes has impacts on the immune system and your ability to handle infections, which includes COVID. And so we counsel patients to be very mindful about COVID vaccination and vaccination for other uh, communicable illnesses, as well as being very mindful if you have symptoms to quickly contact your provider and get support that you need. Infections themselves can elevate blood sugar. We need our immune system in order to fight off infections, and we need regulated blood sugar levels in order to recover. And so individuals that are dealing with an infection potentially are going to naturally have elevated levels of sugar in their blood, which we need to monitor and mitigate in order to recover from serious infections like COVID. So we take COVID and diabetes very seriously.
And what are the best ways to protect ourselves? Like, what do we know several years after 2020? What have we learned about what we should be doing on a day to day basis?
One of the most important things that you can do is, of course, manage your health prior to getting sick. I would just encourage all patients and people to be intentional about health maintenance and regularly seeing your primary care provider and thinking about these things on a regular basis. I often recommend to patients to think of your body almost like your car for those that have vehicles, right? We are required, or it's recommended, that we have oil changes every 5,000 miles. I tell patients, think of a year of life almost like needing an oil change, right? So every 5,000 miles or another year that passes, if you have a birthday, one of the best things you can do is maintain a relationship with a primary care provider that you have continuity and trust, and regularly get checked out before you are ill. And that's extremely important to make sure you have that relationship. So that's the first thing. The next thing is, of course, vaccinations. Vaccinations, particularly COVID vaccinations, influenza vaccinations, these types of vaccinations, although the ability to avoid all infections isn't necessarily there, consistently we are able to show that vaccinations decrease hospitalizations and decrease mortality or death even if you were to contract some of these illnesses. So consistently, I inform patients, make sure you're coming in when you're not sick. But if you have an opportunity, get vaccinations like COVID, influenza, and other things. The other thing that I often recommend to patients is that if you're feeling ill, make sure that you do the proper precautions, right? Hand washing, wearing masks, informing family members. For those of us that have jobs where we are exposed to lots of people, we have to think about not only our symptoms, but potentially our coworkers and other individuals. And sometimes practice a little common sense and thinking forward, how would we feel if individuals came to work and they were sick? And so in a way, being mindful, empathetic, sympathetic towards others and kind, that's often how a lot of these infections are spread because we often go to work or go to school when we're ill. And so if you are able and you have support systems in place in order for you not to work and stay at home, then follow those recommendations in consultation with a primary care provider or some other medical professional that you trust that can support you as you take care of yourself and your family.
Oh, I love this answer. And I have to say, I love the analogy of going to see our doctor every year, like getting the oil change on our car. I think that is wonderful because it's so easy to think, oh, it's okay, I'm fine. But really checking in with our doctor on that regular basis is so important for making sure that our health is intact. I do have one follow up question for you on that, which is I know a lot of times people say, oh, my numbers haven't been very good lately. I don't want to go to the doctor and get fussed at. What would you say to someone who's feeling that way, who's kind of putting off that doctor's appointment until their numbers can be better?
I myself have dealt with issues of feeling insecure or disappointed as I think about my own health care and wanting to get my numbers right, my weight right, my blood pressure right before going in. And I think it's natural to feel that way. So the first thing that I would say is that that is a completely normal response. I will say, as a primary care provider that often deals with the consequences of waiting inappropriately, I think it's extremely important to get ahead of many of these issues. And ultimately, your primary care provider or the providers involved in your care are there to support you. And so some of these fears are natural and some of them stop us from moving forward. I would hope that as you create a relationship with a primary care provider or some other healthcare professional, that most of them would say, we entered this profession to support you, and we're not here to judge you. That isn't to say it doesn't happen. And so at the same time, while I encourage you to push through some of those fears and anxieties, I would also encourage you to hold your providers accountable. And as someone that is paying for a service most often, or even if you are not, there is a responsibility on our end to create an environment for you to feel welcome, to feel a part of decision making. And when that's not happening, I tell patients, hold me accountable. This is not a place where I want you to feel judged. I'm here to help educate. I'm here to help support. If there's something I'm doing that's getting in the way, please let us know, but continue to push forward and try your best to do the things that your medical professionals recommend.
So, Dr. Rayleigh, if someone is noticing that their blood sugar is high when they check in the morning, what are some things they might try to address that?
One thing to recognize about blood sugars is that they do fluctuate, and it fluctuates based upon activity, it fluctuates based upon hydration, it fluctuates based upon the food that we eat. As patients are monitoring themselves throughout the day, it's important to start to notice trends, certain foods, certain activities that may impact that blood sugar. So, one of the things or easiest ways to potentially lower blood sugar if you think your blood sugar is high is staying hydrated. So, water can actually help us not only excrete more glucose, it also improves or enhances, again, that slowing of the digestion. So, drinking water. Believe it or not, exercise lowers blood sugar. Our muscles depend upon glucose or sugar as fuel. And so, if a patient feels appropriate, I wouldn't suggest that if it's so high that a patient feels ill that they exercise. But activity can also lower blood sugar. And so, staying active is, of course, something we recommend that patients do regularly. But if a patient is feeling well and they're noticing their blood sugars are going up, I would recommend some type of activity that could improve that in addition to drinking water.
So, let's talk a little bit more about checking blood sugar. Why is it important? What can we learn from checking blood sugar?
The way to manage diabetes and to ultimately beat diabetes is to understand how it impacts your body and your lifestyle. We know that diabetes is an illness that is a combination of genetics and habits, meaning people have diabetes not because it's their fault. Some of it is in our families. The other component is the things that we eat and our lifestyle and our choices that we make. So managing or mitigating diabetes, checking blood sugar is an important component of that because it helps you as the individual patient begin to notice the patterns of things that lead to elevations in blood sugar and ultimately allows you to have more control over that illness. And so checking blood sugar to me is the cornerstone of managing diabetes because it enhances your own awareness about what this condition is doing to your body. The other important component is that it is data or information for your medical provider. And so some patients don't necessarily have to check their sugar all day, every day. But particularly around the time of provider visits, I recommend to patients don't change your habits because you know you're going to the medical provider and eat less. Go ahead and do the things that you normally would do and provide that clinician with data so they can look at your habits and see if there's potential interventions, not only from medications, but also, again, focusing on lifestyle interventions to set the backdrop for being able to successfully manage and treat diabetes.
In case you're just joining us, we're here with diabetes expert Dr. Rayleigh, covering common questions about diabetes. We're giving away our helpful guide to hypoglycemia that explains what to do if your blood sugar goes low. All you have to do is answer our trivia question, which is, which vitamin is known as the sunshine vitamin? Is it vitamin D or vitamin E? Put your best guess in the comments and you'll get that guide delivered to your Facebook Messenger inbox. So as a clinician, what data would you be looking for? Like when would you recommend someone check blood sugar so that they can give their doctor the best information?
There are really two time periods that are extremely important and valuable to understand what's happening with your blood sugar and your body. The first is the fasting blood glucose level, or the fasting is the first blood sugar in the morning, perhaps before you've had something to eat, or at any time where it's been at least 6 to 8 hours of no food intake. That number in general should be less than 130. So those individuals that do not have diabetes are able to keep their blood sugars generally within a range of 80 to the 110s in a normal situation. The other number or time course is the postprandial, and postprandial simply means after eating. Around 2 hours after eating is a good time to check your blood sugar again. And the number that we clinicians often look at is less than 180. So I offer to patients, if you can remember two numbers to look for, less than 130 before you've had anything to eat, and less than 180 after eating. If your numbers generally are within that parameter, your hemoglobin A1C will shake out to be around 7, which is again our goal. If patients notice that those fasting or AM blood sugars are more than 130, that could indicate we need to make some changes to medications or changes to diet or lifestyle. And similarly, the postprandial or the blood sugar after eating, if it's consistently above 180, I would recommend to patients that they contact their provider and talk about the timing of medication in addition to the dosing of medication. And that's again just a reminder of why it's so important to check your blood sugar so you can know, well, today I ate this particular meal, and when I checked my postprandial sugar, it went to 220. Well, perhaps using that data, you can adjust not necessarily what you ate, but how much you ate. So a practical example, if I normally would have, let's say, 2 pieces of chicken, perhaps I check my blood sugar, it goes up. But when I have one, it stays within that range. So I know, well, I probably shouldn't be eating that particular thing too often. But if I do, if I limit myself to one serving or a less of a serving, I'm in range, and then your body's happy, your clinician's happy, and more likely than not, your hemoglobin A1C is going to be within the goal that you want.
So many people we hear from on our Facebook page or in our Facebook group feel like diabetes is their fault, that the choices they made gave them diabetes. What would you want someone who feels this way to know?
We know that most conditions are a complex interplay between our genetics, who our parents are, which we had no control over, and our habits. And so an individual that perhaps is blaming themselves, I would offer support and empathy and sympathy to them to say, while there are choices that most likely you made that contributed, that doesn't mean that it is in fact your fault, because you did not choose your parents simply by accident of birth. You are who you are. And so having said that, what we do know is those lifestyle changes or choices post diagnosis matter. And while I believe what's past could be prologue, individuals that are diagnosed with diabetes have an opportunity to really impact their future by being intentional, learning about the disease, learning about medications, talking to a medical provider. And it is not hopeless. You can beat diabetes with support. It is a difficult diagnosis to have and to carry. It impacts so many. So I like to tell that individual that perhaps is feeling a certain type of way, it's not your fault, and you're not alone. Not only do you likely have individuals around you that are managing diabetes well, potentially individuals struggling with diabetes. I would hope that you are also able to establish a relationship with a trusting clinician that allows you to recognize that it truly takes a village in order to manage this condition. So please don't be alone. You are not alone. There are many resources that you can utilize to help you beat this disease.
Oh, I love that. Dr. Riley, one person wanted to know, is metformin bad for people with diabetes? I know that's such a common question. What would you say about metformin?
When we look at the guidelines from the American Diabetes Association regarding diabetes, metformin is actually considered first-line therapy. And metformin is a great medication for many patients to treat and help diabetes. It's been around for a long time. It has some weight neutral benefits, meaning that it doesn't necessarily cause weight gain. And the side effects, while there are some, are generally minimal. The cost of the medication is generally less, and it's widely available. So I am a fan of metformin for certain patients, and initially as monotherapy for treatment of diabetes. And so I would offer to patients that want to talk with their provider about metformin, it's a good first option to utilize in order to treat diabetes. Many patients often need more than one medication, but I also have patients that are on metformin. The key really is to follow up with your primary provider to discuss if metformin is working for you. And so not every patient that I take care of with diabetes is on metformin. Some patients started and tolerated. There are some side effects that are worth noting and particular impacts. If you, for instance, have chronic kidney disease, metformin may not be the best medication. If you're having gastrointestinal side effects, metformin can potentially lead to worsening of that. And so close consultation and conversation with a medical provider about your specific recommendation or your specific situation with metformin is extremely important. And follow up and follow through if you develop side effects. And again, educating yourself about your medications, being consistent when you take that medication, that is a great start no matter what medication you're on.
Dr. Railey, one person wrote us saying, I'm at a 10 something A1C. I've been checking my glucose for a week and it hasn't budged at all. I'm on metformin and I feel so defeated. What would you want them to know?
First of all, let me just validate that feeling of frustration regarding diabetes, which is a chronic illness and it is a difficult condition to manage. Many patients struggle with this. And so the first thing I just want you to know again is you're not alone in the feeling of being defeated. That's important to vocalize. It's important to admit when we are struggling. That in and of itself can be freeing as we admit the difficulties that we're managing. What I would offer is that it's important for us to communicate with our provider. Being on one medication may not necessarily be the answer. So one of the things that we often need to do is communicate that we're frustrated, communicate our limitations. And there are many when managing diabetes, not only side effects from the medications, but also cost considerations, practical considerations around just life getting in the way. And so I always encourage patients to be as transparent as possible about that feeling of defeat and also working with your primary provider in figuring out what works well for you. We often hear individuals say, my friend, my cousin, a family member is using this. And that sometimes can be helpful. Other times it's not individualized enough for your specific situation. So as you are managing and mitigating diabetes, figuring out a way to integrate this into your lifestyle in this new reality that you're facing should be done with the help of a caring and trusting provider. And so I would encourage you to talk to your provider about that feeling. Be open to potentially having changes, which might include changes in medications. It might include changes in frequency of visits for the short term. But these types of things are investments for the long term. I often recommend to patients, it's not so much that we should be focused on the week to week you. I want you to think about 5 years from now, 10 years from now, if you can. And we're paying that person a favor because at this time, it is going to be difficult to see changes right away. But over time, if we can work together, if we can stay consistent and have discipline, which is not easy, that person 5 years from now, 10 years from now is going to see the benefit. And hopefully, with help, with assistance, with support, we can get you to a point where you feel good about your medications, you feel good about your diagnosis and the progress that you're making.
Wow, Dr. Railey, thank you so much for joining us tonight. This has been such an inspiring conversation.
It's been a pleasure to talk with you. Thank you.
And a big thank you to everyone watching at home. We so appreciate you being here and chatting with us in the comments. Before we go, here's the answer to our trivia question. Which vitamin is known as the sunshine vitamin, vitamin D, or vitamin E? The answer is A, vitamin D. If you didn't get to answer the trivia question, but you'd still like that guide to low blood sugar, just leave a comment for us and tell us what you thought of the show. We will be back to you with a new episode in a few weeks. Until then, please stay safe and take good care. Good night.